Dr. Aaron here from Active Wellness Chiropractic and Rehab. Today for our blog post, we're going to be discussing rehab from surgery. Many people don't realize that as a chiropractic office, we employ a wide range of techniques to be able to do your post-surgical and pre-surgical rehab. So let's talk about first what that actually really looks like and what that means. One thing we do at our office when it comes to surgical rehab is first determining if you're a surgical candidate. What does that really look like as a consumer, as a patient? What we do from day one, from assessing your injury, is we classify you as to whether or not you're a surgical candidate. Why this is important to you as a consumer is that if you're not classified as a surgical candidate, the likeliness of the surgery actually working for you is significantly less than if you are classified as a surgical candidate. After we classify you as a surgical candidate, what we would do is we would line up with you the surgeon that we would like you to go see, or the surgeon that might be the potentially best fit for you. Not all surgeons are the same, and certainly not all surgeons work well with other people. So having those relationships in this community help us better pair our patients with the appropriate physician to perform that actual surgery. Once we've scheduled the appointment for your surgery, or you have scheduled the appointment for your surgery, one of the things we will do leading up to that is your pre-surgical rehab. What that means is developing proper ranges of motion in relation to the injury that you've sustained, a little bit of strength, and then also talking with you about what you can be doing at home to give yourself a better post-surgical recovery. Once you've scheduled your surgery, we will work with you and the surgical physician to determine the appropriate post-surgical rehab for your condition. What that means for you is that we'll schedule all your condition. What that means for you is that we'll schedule all your appointments in advance prior to you actually having the surgery. Once you've had that surgery, we will meet with you within a week of your actual surgery to get started on your recovery. The sooner is actually a little bit better. Our office employs the most current and up-to-date strategies as far as post-surgical rehab goes, from scar tissue reduction to blood flow restriction, strength training, to dry needling, to stability and active and passive range of motion. If it's in the protocol for your surgery, we can take care of it in this office. We hope this gives you a better idea of what post-surgical rehab would look like, or what it should look like in an active care model, really empowering the patient to take some of the rehab into their own hands. You truly are the one that does all the healing. We just help facilitate it and employ the techniques that give you a better chance to recover a little bit faster, and honestly, to come back a little bit better than you went into the surgery, or 100% better in that matter. So if you are considering having surgery, or just want to know, is surgery, are you a candidate for surgery? Like I said, set up an appointment at our office. We'll put you through the classification system that our office uses and determine if surgery is the best option for you, or if it's something that can be taken care of in our office or with a home care plan.